I've been self-employed almost all my life. When I ran larger organizations, I had pretty good group health. Today, my wife Brenda and I have catastrophic coverage only, and if I need a major operation, it costs me about $10,000 deductible each year. Even for this, our premiums are around $1,000 a month. No one else pays our health care, and I ration its use pretty carefully. When I face a major operation, I might be tempted to go over the fence to my neighbor's pasture and borrow one of his cows. Once I steal it and sell it and get the money for my health care, though, that's a crime. It's called cattle rustling. It's not a small thing. It used to be a hanging offense in Texas. Liberal Americans have been voting themselves one form of entitlement after another for the past 50 years. One group or the next is entitled to this or that, and because they're due something, somebody else gets to pay for it. Government-run health care is just the latest and greatest version of this form of self-gratification. Liberals are so stuck on redistributing their neighbors' wealth that Washington pushed through national health care in the face of certain evidence that we couldn't afford it. Health care shouldn't be a government-rationed entitlement. Obamacare only increases out-of-control costs. It destroys the bond between patient and physician and impairs both quality and availability of health care. My own health care choices become clearer as I get older. I'm tempted a little more each year to wonder whether I should spend my resources to pay the premium. I ask myself that I make the right choices in the past and save enough or work my hardest to make the most. Did I do my utmost to live a healthy life and follow the best advice on all forms of preventive medicine? It is, after all, much cheaper. My values tell me to be individually responsible, to give thanks for my blessings that I have today, and not look at somebody else's circumstances and covet what they have at whatever cost. My neighbor may have been healthier than me, or may have more resources for whatever reason. Above all else, I'm not willing to put my country's fiscal soundness at risk over this. Our founding forefathers got along just fine without national health care. I am not willing to bet the country on it being necessary now. As you learn more about what I stand for, you'll see there are a lot of tough changes I'm in favor of so that our country can work out of the predicament we're in today. I just have a sense of certainty that if we do the difficult work of resisting the entitlement poisons that we've been handed, and we get back to a self-reliant America that always found solutions and forged ahead, we'll all be much better off. We might even wind up handing off a solvent, strong country to our kids and grandkids instead of a debt-burdened bureaucracy like the liberals have in mind. Margaret Thatcher, the former Prime Minister of England, famously said once, "Socialism sounds great until you run out of somebody else's money to pay for it." Today, we've run out of our own money, so we're borrowing trillions every year. It's so bad that now we're printing trillions more. It's a no-brainer for me that national health care was a bad idea from the beginning, spawned by the wrong people. It needs repealing, defunding at the very least.